This is the Real Health Podcast brought to you by Riordan Clinic. Our mission is to bring you the latest information and top experts in functional and integrative medicine to help you make informed decisions on your path to real health.
Okay, everyone, welcome. I'm Dr. Ron Hunninghake, and this is another episode of the Real Health Podcast. And I am thrilled today to have Mr. Jason West and Mr. Dan Schweitzer with me. Jason is the CEO of Hyatt Life, and which is the maker or the distributor of Afaya, the various Afaya products, and we'll define what that is in just a minute. And Dan he's an individual who had a great response to the Afaya products, and we're going to hear a little bit more about his story. So welcome, gentlemen.
Thank you.
Thank you for being on Real Health. So let's just ask a question. What is Afaya, and how does it contribute to real health?
So Afaya Plus is a dietary supplement that we developed here several years ago, and the idea was essentially focusing on general health and wellness. It is mainly derives from a plant that grows wild in the Middle East called Arum Palaestinum. Over in that part of the world, they call it Solomon's lily or loof. And it's just well known over there as what we would probably call an old home remedy.
Yeah.
If over here in the United States, if you get sick, your mom brings you some chicken noodle soup. Over there in that part of the world, she'll bring you a tea that is made from this plant. So they just chop it up, and they've been doing that for centuries.
Well, and we talked earlier, it's an herbal treatment, and herbology really is the foundation of medicine. Mm-hmm. You know, Ayurvedic, Chinese medicine, they all revolve around herbal strategies. And so in many ways, we're taking the past and bringing it into the future.
Yes.
And how, speaking of the future, how did this even get here? You know,
it's a very long story. I don't know if we have time for all of it, but my dad is from that part of the world,
right,
and was over in Jerusalem.
That is Gene Zad.
Gene Zaid, yep.
Zaid,
and he's checking on my grandfather at the time. I think this is back in 2005, and he was in kind of some poor health, and just went over to see him and look in on him, and ran into an older gentleman that he kind of grew up with too, and this gentleman knew that my dad was a chemist and had a laboratory in the United States and had, resources available to look into this plant a little bit further. And he said, "Hey, do you remember this plant from when you were a kid?" Dad's been here in the United States since he was 17. So this has been a minute.
Yeah.
And he said, "Yeah, I do remember that. I don't know anything about it." But he said, "Well, take it back to the United States and I want you to research it." And so he did, and lo and behold, found some naturally occurring molecules in the plant, just what the good Lord gave us. And they do, in fact, fight cancer. And so from that effort, we formed a drug discovery and development company called Genzata Pharmaceuticals, and have taken that through that product or that drug that we created as a result of kind of being inspired by what's in the plant is now a clinical stage product. So it's been in phase 1 clinical trials and performed quite well. And we've got more work to do, but that's the direction that we went.
So, but the product itself is it's a whole plant, and that this is derived from. Mm-hmm. And so, and what you're doing is taking out parts of it that you feel are the more active biochemically.
Correct. When we identified the molecules that are just naturally occurring, we kind of cherry picked some of those. I think there was 117 different molecules in the plant. We chose 3, and that's what became the drug. And so it's fully synthetic and made under GMP conditions, and kind of different path entirely. But along the way, we realized that people really had a desire for this plant as a supplement to what they were doing, health wise. And so that's how we created Hyatt Life Sciences. It's kind of an entire parallel sort of project.
So the Afaya Plus, which was the original supplement, that tended to have a lot of uses, but wasn't it mainly in the area of cancer that people got really excited?
That's where most of the people that found us early on, and we started making the tea kind of in the ancient preparation. That's where we started our research. And we're from a pretty small town in central Kansas. And so everybody knows your business. And there was a knock at the door and they said, "Hey, I heard you guys were making some tea. Can I have some?" And we said, "Well, sure. These are just, friends that we know around town." And they said, "Would love to give it to my wife. She's dealing with some stuff right now." I said, "Okay, sure." And came back several times more for some additional tea. And lo and behold, she, I guess, got a diagnosis of being in remission.
Yeah.
And we said, well, we're glad to be part of that. But we didn't really think that it was anything to do with us. I mean, we thought it was, just a fluke, frankly. But as time went on and we saw more and more results, we said, well, we need to keep doing this to help people. Yeah.
Well, and a lot of times nutritional therapies don't just treat one thing. And I'm sure, this is not the only cancer, or wouldn't be the only thing, because it seems to be helping the body from the ground up.
Yeah.
And plus, I think the plus part of this, if you've added things like vitamin C
mm-hmm.
and turmeric and a number of other good products that are helpful for rebuilding health.
Yeah, exactly. And we think that there's in some form or fashion, it's really boosting the body's immune system mm-hmm. and helping the body fight off, a variety of different things.
Well, the big thing in cancer therapy is immunotherapy. So anything you can do to boost the immune system, because there is a surveillance system in the body, because we're all getting cancer cells mm-hmm. here and there. But if we've got a strong immune system, then it will identify the cancer cell, knock it out, and maybe even help the body be even stronger against it down the road. Yeah. So I see this guy sitting over here. This doesn't have anything to do with him, does it?
It might. It might.
What's going on with you, Dan? How did you play into this Afaya Plus story?
Well, a year ago right now, my journey began with cancer. I took a random physical for some life insurance in January of 2023, and I was denied. They called and said, "You're denied." I said, "Why?" They said, "Your PSA is too high." I did not even know what a PSA was. Wow. I said, "Well, how high is it?" And they said 12. I said, "How high should it be?" And they said 6, no higher than 6. I said, "Well, okay, I feel pretty good. I don't really believe you." Put it off for about 3 weeks. I went and saw my own doctor in Hutch. I farm just west of Hutchinson, farm and ranch. And so I went into my own doctor and I said, "Hey, my PSA," they said it was too high. Let's take another PSA just to see. Came back 30 days later from the January. It came back at 14.13. So it had raised 2 points during that 30-day period. He was alarmed. He said, "Get to a urologist." I did. They took a biopsy. I was diagnosed with prostate cancer. Well, you always hear if you catch it early, that's not a big deal, right? Right. Well, I hadn't been to a doctor and had a checkup for 19 years. So my odds weren't real in my favor. At that point, my wife had gone to Sterling. I live just 8 miles away from Sterling. I did not know anything about Hyatt Life Science.
The birthplace of Hyatt.
Yes.
Hyatt,
I had no idea. We had heard that there was some supplements and stuff. My wife had heard more than I. And we'd had some neighbors that had some health success. And so I had not been taking any vitamins up to this point. And she goes, "You need to get stronger. If this is real, you need to get stronger." And so she ran in and got some Afaya Plus. She came back. I looked at the bottle and it said, "Take two a day." And I thought, well, I'm a bigger guy than normal and I've got a lot more problems than normal. So I took 4, started taking 4. When this thing started to progress and it came back that I had prostate cancer, about 3 weeks later, a gal came up at church and she said, "You need to be taking a product called Pro Afaya. It kills cancer." And I said, "Well, I'm taking some stuff," but I looked, it was not Afaya Plus, it was Pro Afaya. It's different stuff. So I looked at the bottle, we went and got some, and it said take 2. So I did exactly what I always do. I took 4. And so now I'm taking 4 Afayas a day, 4 Pro Afayas a day. And at this point, I had a CT scan to see if it had spread. And it had not spread into my organs at all. Mm-hmm. And the chances of it getting into my bones, it would have been higher probability it was in my organs. So I wasn't really worried. But when I did my bone scan, I was stage 4. It had metastasized, and it had been metastasized.
And you were feeling completely well.
I was fine. Yeah. It hadn't hit me at this point. Was not having any aches or pains. But when they called and said that they had found it in multiple places, I just was joking around and said, how long do I have to live? Because they had a pretty good protocol, what they were going to do. They were going to do chemo. They were going to take my prostate. They were going to do radiation. I said, okay, well, doc, how long do I have to live? With all that being said and done, if I do all that, they said, we'll guarantee about 2 years. And that was a shocker. So at that point, I decided to go to KU Cancer Center. So I made an appointment April 20th. In the meantime, one of my neighbors actually works for Hyatt Life Science. She calls and asks my wife, maybe Dan ought to talk to Dr. Zaid about his problem. We've heard. And so I went and sat down on April the 19th. And when I sat down with Dr. Zaid and Dr. Mull, told them my situation, they suggested that I take 9 pills of Afaya Plus. That 3 in the morning, 3 at noon, 3 at night with fatty food. They said that was key because it's fat soluble. And they said, if you do that, they're probably they said, go ahead and do everything the doctors say. They'll probably do chemo, but this will help with the side effects of your chemo because it's going to be pretty hard on you. And then after your chemo protocol is done, make sure you have another bone scan and another CT scan because chances are you may not have cancer at all. And of course, I didn't believe them. I never met these guys. I didn't believe them at all. But I decided I was going to give it a whirl. Went to KU, and they prepared me for the PSA test that day. Had been 60 days since my last one in February. This was April.
And how long had you been on the 9?
Approximately 2 months.
2 months on the 9.
Yep.
Okay.
Or at least the 8. At least the 8. Because I just started the 9 the day before. But on the 8, I'd been on.
So you worked up to the
I did 8 on my own just by chance. Dr. Zaid said I should be taking 9. So,
okay, wow.
So I went up to KU. They said, be careful, be prepared. Your PSA is probably going to be 18 based on the math, 2 points every month, raising 2 points. And it could be as high as 20. And so they said, be careful. Don't panic. We'll get on top of this. On my way home from that appointment, we were still in Kansas City traffic. Traveling back, and my wife was driving, and I got a text, and I just started to cry. I couldn't believe the number on my phone said my PSA was at 10.27. That was not quite. That was not quite a 30% reduction in my PSA in 60 days, and I was doing nothing except taking 8 of these Hyatt Life Science pills. And so I called KU back and I said, well, can you explain that? That's almost a 30% reduction. My cancer, you said this PSA was going to be a marker, how it was going to be reducing in my body. It's dying and I haven't started anything. I was taking no medicine. They said it was a difference of labs. I had taken my PSA in Hutch. The PSA that I just done at 10.27 was in Kansas City, and that was the explanation I got. I did not buy that doctor, so I went to my own doctor that I'd been to at the 14 point, and I said, I will pay for it myself. I want to have a PSA before we start my chemo because I want to know what it is. They said it's a difference of labs. I don't believe it. It came back. The same lab that I had 14.13, just 60 days prior, 9.8.
Even a little lower.
Yes, 30% plus reduction. So now they had no explanation what was going on. But at that point, I became a believer that this product was actually helping fight my cancer at this point.
You were becoming a scientist because you were using data to show that you were actually getting better. That's different than just believing in it. That's actually that's functional medicine.
Yes.
Where you use the actual lab work to help verify what you think is going on.
And that's what we do on the farm with cattle. That's exactly how I did it. So now I had that to grasp a hold of. We started the chemo. They begged me to get off. They told me to get off of the Afaya, that it would have adverse effects on my chemotherapy. I was going to have a chemo session every 3 weeks for 6 sessions. And they said that I needed to get off. Well, I just would not get off. Right. And they told me the side effects.
You sound like you're a farmer. You
yeah.
know, do what you want to do.
Pretty much do what I want to do. My health, my problem, my decisions.
Good, though. Good.
Yep. So they told me that this chemo that I was that qualified for was going to be very hard on me. It was going to make me sick. A lot of foods that I was going to eat was going to make me nauseous. I was going to not want to eat. I was going to lose a lot of weight. I was going to lose energy. I was not going to probably some days even want to get out of bed. If I did get out of bed, I'd only be able to spend 1 to 2 hours working at a time, and then I'd have to rest. So I revamped my whole farm operation because I have a 19-year-old son at home and an 86-year-old father, and they were going to have to carry the load. So we revamped our whole planning on what we were going to do. And I sat down for my first chemo session. And they gave it to me, and they said that whatever you do, be careful going to the car, go home and rest, don't eat because you're just going to want to throw up. I got up, I jumped up out of the first chemo deal. I said, man, I feel fine. You sure you gave me the right stuff? And they said, yeah, we're sure. I said, well, okay. I walked out to my car. I went to Freddy's and had a double cheeseburger and went home, 40-minute trip home. Felt fine. I changed my clothes, got in my tractor, started baling hay. They called me about 4 hours later from the doctor's office and said, how you doing? And I said, well, my hay's drying out faster than I can bale it. And they said, you're baling hay? And I said, I'm baling hay. And I said, I've been baling for the last 4 hours. I said, what do you guys need? They said, we're checking up on you to see how you're doing. I said, I'm doing fine if you would leave me alone. And so I baled hay for another 9 hours at that point. And the next morning, I thought it'd hit me. I thought I'd get up the next morning and it would. I was not sick one single day through my entire chemotherapy sessions for the next 3-4 months. I never was nauseous on any food that I ate. I had tremendous energy. I was able to cut wheat 17 hours in a day. I just did the normal things. It didn't slow me down. I did lose my hair. They warned me I'd probably lose my hair. I went bald. And at the end of the last session, the 6th session, they really punched me pretty hard with some extra stuff. And it turned all my fingernails and all my toenails black. Wow. And they started to smell and they started to detach and raise up. And I called the doctor and I said, what's going on? They said, oh, that's one of the side effects. We expected that. They're all going to fall off, Dan. Sorry about that. Well, I farm and I put on gloves when I work and I couldn't get the gloves on because the fingernails caught and it was just, they hurt and it was interfering with my work. I talked to Dr. Zaid and I said, Doc, I'm having this problem. He said, no problem. He said, I've got a product called Arum Palaestinum. It's Afaya Plus. That is in gel form. It's like lip gloss form. And he said, you just rub that, put it underneath the nail, put it on top of the nail, cover them up. And he said, in no time, those nails will reattach and you'll be fine. So I did. I religiously, in the morning and the night, I'd put Band-Aids on and I'd stick all that Arum Palaestinum on. And I did not lose a single fingernail or toenail. And I still have the effects. You can see the tips of my fingernails are still colored, but they quit smelling. The black went to brown and then went to just kind of a whitish color and everything was fine. So I get done with my last chemo. They schedule me for a prostate removal surgery and they schedule me for radiation in my bones because they've told me the whole time, this chemo does not kill your cancer, Dan. It shrinks it and makes it smaller for that radiation pinpoint, and so we're not having to radiate such large spots in your bones. And so we got done with that, and I said, I would like another scan. They said, there's no need for a scan because your cancer's not gone, Dan. Chemo doesn't kill cancer. I said, well, I'm pretty animate about demanding a scan before we start all this stuff. I don't want to have a prostate removal and radiation until you prove that I still have cancer, because I was told that my cancer had a good chance of being gone. After arguing with the doctor and insurance companies for a little bit, the doctor finally agreed that this would be a good idea. I think he just wanted to shut me up. As you can tell, I can talk. And I'm pretty forceful. And so he scheduled it. I had my CT scan. It came back clear. This was in October now. I was done in the end of August. They took me 30 days to fight through the red tape. It's 1st of October I go. My CT scan was clear, but that was clear before, so that was no big deal. The bone scan, that was the big thing.
That's what I was going to ask you about.
That was the big thing. And so had a bone scan. And the doc called from Kansas City and he said, Dan, your bones are completely clear. He said, not only are they clear of cancer, there's not even scar tissue anymore. He said, I can't radiate your bones. If I wanted to, it'd be like shooting in the dark. He said, there is nothing there. He said, I said, have you ever seen that before? He said, I've seen one spot go away, but I've never seen all spots go away. He said, no, sir, I've never seen this before. I said, what about my prostate? Still want to take that? He said, your PSA is at 0.13, which is the lowest detectable point that the PSA can go. And he said, that's been that way for months. And he said, so there is no live cancer in your body. There's no need to take your prostate. He said, at this point, you are in total remission. I said, well, what's the plan? He said, we're going to monitor you with a PSA test every 6 weeks and a bone scan and a CT scan every 6 months. And we'll do that for 2 years. If we go 2 years and it's all clear, he said, you're done. You'll live a normal life and everything's back to normal. That was just in a span of January to October. I went from looking at a death sentence to completely total in remission. And really the whole time, if you wouldn't have known I had cancer at all, except I lost my hair.
Yeah.
And I got it all back.
Yeah, you did. Hey, Dan, I've got a really key question for you here. Did that doctor ask you what you were doing that could possibly create this kind of benefit?
So I did not tell the doctors. I took my chemotherapy in Great Bend. So I had multiple doctors at KU monitoring and at Great Bend servicing. And so these doctors, the whole time, I kept asking them questions. Why am I feeling so good? Why am I getting these why did my PSA go to almost 0 in the third chemo session? And you didn't even expect it to hit that point at the last chemo session. Why is all this happening? We don't know. Never seen something like this. Can't explain it. When it was all said and done, I felt, because they were pretty adamant about me not taking this. So at the end, I sat down with these guys.
You revealed the story.
I said, well, guess what, guys? Because they told me, you have just phenomenally responded to our chemo. We are so happy for you. And I said, well, I've got a confession to make, guys. I said, I've been on that Afaya Plus the whole time. I said, I did not stop. And so do you think that had anything to do with all the unexplainable phenomena we've seen this whole time? They said, absolutely not. I said, well, then what do you attribute? They said, it's possibly the love and support of your entire family. And I said, that's true. I have had tremendous support, but I don't believe I got cancer with that love and support from my family. And I don't think that maybe really was the whole cure. I said, the only thing that wasn't there before was the Afaya Plus. So I said, I have to beg to differ. After thinking back, I do think that the love and support of my family was key because they supported me staying on the stuff.
There you go.
So many families look at this and say, oh, you got to obey the doctor. Do not do anything, whatever. And so I said, well, Doc, don't you think that Afaya Plus had something to do? He goes, well, you can't prove that it did. And I said, but you can't prove that it didn't. And he said, you're right. He said, we'll just leave it right there.
Yeah.
So that's all that they would give me.
There's a famous book called Radical Remission that a lady wrote because she was counseling cancer patients, and a number of them would go into remission using various therapies and whatnot. And when they went back to the doctors and said, hey, I'm in remission, the doctor said, great, go your way. No interest at all.
Not why.
What did you do that helped you get into remission? So that's a very important part of integrative oncology. And so we, here at the Riordan Clinic, we now have 2 integrative oncologists on staff. And I really like the term because you're a perfect example of integrating the best of conventional therapy and the best of natural therapy. I'm the best in this case because it worked.
Yeah.
And so I think that's probably what we need to focus on at this point. What is it about Afaya Plus that would help a person accomplish this kind of a result?
Can I add one more thing?
One more thing.
I had a very, very good friend that was diagnosed with the same stage 4 prostate cancer prior to me, just months before me. We graduated high school together, so we had known each other for a long time. He was not as tall, but we had the same build. He was even healthier than I was.
Was he a farmer?
He was not.
Okay.
But he was really active and he was really into his health, which I'm not. I'm into working, not health.
Well, that's a healthy thing.
That's right.
But anyway, he had the same chemo thing, different doctors, but the same chemo, everything was the same. We'd compare notes. He had the symptoms of the chemotherapy. He was tired. He couldn't function. He was sick. He had so many of the side effects. Right. When I started to see what was happening to me, I told him about it. I said, you got to get on this. He did for a little bit, but when the doctors found out that they said, get off, he did get off. So our paths were not quite identical because he was one step ahead of me, but I had to go to his funeral and bury my friend just 3 weeks ago.
Yeah.
And that was the only difference was the Afaya Plus.
Yeah.
Our paths were exact except for that. He just couldn't stay on it because his doctors kept, and he kept saying, I trust the doctors, Dan. And that was the only difference. So.
Yeah, we find that conventional doctors are not trained in any kind of holistic medicine, nutritional medicine, or herbal medicine. Certainly, I mean, even though it's the foundation of the history of medicine, but there's this idea that if there's not research, then this thing does not exist. Well, how do you bring it into the realm of believability unless you offer to do research? And I think a good scientist would say, hey, this is a clue. This is a clue. You're an example. Yeah.
When I told the doctors at the end, I thought that's what they'd say. This is amazing. Tell us more about it. They wanted nothing to do with it.
Yeah, there's a kind of an intimidation about the whole thing about natural therapies, and I guess it's because we've accepted a predominantly pharmaceutical approach to just all chronic illnesses, without really having a good way to rebuild health from the bottom up. And I think my experience with herbology, I've kind of been recently reading more books on it, because herbs basically contain all the phytonutrients that the body needs to boost the immune system, to detoxify. Because as a farmer, certainly you were exposed to a number of toxins, and even your friend, the non-farmer, he probably we're all exposed these days. Right. And so we need a way to reduce inflammation. We need a way to help us to have more energy. And so natural medicines like Afaya can certainly do that. And plus there is vitamin C in the Afaya Plus. Mm-hmm. And so we here at the Riordan Clinic, we use a lot of IV vitamin C, but again, we're using it in an integrative fashion so we can get the best of both worlds, because ultimately what you want is what you got, which is a cure.
Yes.
Yeah.
And I think, just back to your question, Dr. Ron, about, kind of what do we think is going on, drawing on our drug research and all of the data that we've been able to generate on the drug side of our business, we're backwards integrating. We're kind of drawing some parallels there. But what we saw with our drug research was a concept called super enhancer modulation or super enhancer inhibition. And it's a relatively new concept, I think, in medicine. I think the first paper came out in maybe 2013, talking about super enhancer genes. These are essentially genes, super genes, sit up at the very top of the pyramid, and the cascade of effect that they have on downstream genes, downstream processes. There's proto-oncogenes that tend to naturally cause cancer or mutate and cause negative things going on. There's naturally tumor suppressor genes. And our research showed that our drug seems to be doing a little bit of both kind of fighting against the proto-oncogene and also helping to prop up or support that tumor suppressor gene. And so, if there's something similar going on, maybe with the dietary supplement, that might explain why we're seeing some of these similar kinds of outcomes that Dan had. And it's just the research that we would love to do on the supplement, to study it and to create, literature about the results and study it in a more, I'm going to call it proper scientific way. Those are the kinds of things that we would jump at. The integrative oncology idea is something that has been, very interesting to me for a very long time. So I'd love to do more.
We use a metabolic approach to cancer, namely that the metabolism requires oxygen in order to work properly. And we now know that when cells become lacking in oxygen, and it can happen in just certain areas of the body, not so much that you're asphyxiating, but that certain cells in the body are asphyxiating. And when they do, their metabolism shifts from using the mitochondria to going into what's called glycolysis, which is a very old form of metabolism that does not require oxygen. And these cells are just trying to survive. And the reason that it's happening is because just what we talked about, inflammation, toxicity, stress, deprivations of various types. All these things tend to deplete the body's immune system and responsiveness to the factors that we now call oncogenic factors. And so I think what Afaya seems is bringing back is the ability at a holistic basis to improve the body's adaptive response. Maybe it's doing something to restart mitochondrial functioning, working at the mitochondrial level. Is it now? There's a new one out about, was it Afaya glucose or what?
There's again, somewhat from COVID, we just heard a lot from our customers and listened to what they were telling us. And one of the biggest and most common pieces of feedback we got from our customers was, I've been taking this Afaya Plus for a little while now, and my glucose numbers are falling. What's going on there? It's the only thing I'm doing different. And so we looked at the ingredients a little bit closer, said, well, maybe there is some glucose control activity going on there. And so we spun out a different product called Arum, and sure enough, it does seem to be helping and lowering glucose levels and helping people control it and keep it in check. So
you probably had a PET scan?
I did.
And you know what they give you when you get a PET scan? It's radioactive tagged glucose. Yes. And the cancer cells love glucose. So if you can lower the glucose level in the body, you're starving the cancer cells and helping your immune system do a better job of fighting the cancer. And then all credit to the chemotherapy. But the part I heard about you is you didn't have the side effects of chemotherapy. So you had a greater resilience within your body.
And also, they warned me the whole time, especially after the second session, that my immune system was so low that I needed to restrain from going into large crowds. Don't go to church. Don't go to funerals, that kind of thing. I did not listen to that either.
Farmer.
Yeah. I felt that this stuff was building my immunity. I did go to funerals. I went to the state fair. I walked around,
That's right.
I did everything against that. And I was not sick. I didn't even catch a cold that entire time that I was on the 9 pills. And I'm still taking pills. I'm still taking 9 at this point. I was going to drop down because if you continue to take this product, it will keep the cancer from coming back. And so I was weaning myself off of it. I was never going to go clear off. But after I lost my buddy, I went back to 9.
Yeah.
Because I decided 9 pills is not near as bad as laying in a casket. So, but that is one thing. My immune system was really bolstered. I even held hands with people with COVID that we thought weren't going to make it. And I did not do that with a mask on. And they were not wearing a mask either. And I never caught COVID.
Yeah. So again, our whole paradigm of health is actually disease treatment. It's treat the disease. What I think Afaya is bringing and what we're trying to bring here at the Riordan Clinic is let's build the foundation of health. Let's make you as healthy as you can possibly be. Then you're going to be able to, faster than a speeding bullet, able to tall buildings in this.
That's me.
Yeah. Really, it's a kind of a super health is what it is.
It really
and
is.
so, because a lot of people, they don't quite believe that you can. Now, I think more people are because we have more people exercising. We have more people looking into dietary improvement. More people are looking into supplements. Now we're looking into the effectiveness of supplements. And I think what Hyatt Life is doing is bringing a solid scientific foundation to this. This is just, it's not yours. It's just not a story. It is a story. What a compelling story. But the science is there.
It's behind it.
Yeah. And that's what's, that's a key thing in this whole paradigm that we're in right now.
Yeah. And that's something that we talk about a lot, just internally is, one of our kind of marketing literature that we have is putting science behind the tradition.
Yes.
This product, this tea that we kind of stumbled into in 2005, has been going on since the 9th century A.D. Now, what in the world is going on? If it's still in use today after 1,100 years, there's got to be something going on. There's got to be some benefit. Otherwise, humanity would say, I don't have time for that. But we want to put some science behind that traditional treatment or traditional medicine to say, why is it doing this? We want to understand more about, why we're doing it so that we can help more people.
The thing about herbs, as opposed to just supplements, vitamin supplements are necessary, but you have to have the whole team of nutrients. And that's why we test all the vitamin levels. The thing that's nice about herbs is that they are complete in themselves. And you're basically kind of looking at the drug aspect, taking out the most active components. But if I were to get cancer, I would do the Afaya and the conventional treatment, but not just one or the other, just do them both.
That's right.
That's your best bet.
Yeah. We did a lot of again, back on the drug testing that we've conducted, we've done a lot of studies on our drug plus other existing cancer drugs. And every single one, almost every single one that I can think of right off the top of my head, there was some sort of synergistic effect. Now, again, if we apply that same logic to what's going on, with Afaya, that might explain some of Dan's experience as well.
Well, there are some immunotherapies now where they're using two. They found that two together works better than one.
Yeah.
So synergism. Synergism is probably the best way to go. So where is this going for Hyatt Life?
I think, more and more, we're just trying to get the word out and saying, hey, if we can be helpful to someone's situation, would love to be part of that. I think often, and Dan, I hope it's okay to tell this story, but when he got the call and got that notice from his doc back in October, and, I think you guys were there at our office that afternoon. And everybody comes to the front, entryway there, and he's telling us, that he got the all clear from his doc. And I think somebody was cutting onions in that room somewhere because my eyes were watering, your eyes were watering. I mean, everybody's eyes were watering, and I'm sure it was the onions. And, it's that kind of thing that, it's incredibly gratifying. This is a guy who's now instead of thinking about a diagnosis, he can think about, turning his farm over to his son. He can think about spending time with his wife and his daughters. And, that's exactly why we do what we're doing, is because you can't overstate or overemphasize how much meaning that has. It's incredible.
Well, we're also living in a time of a cancer epidemic. I mean, yes. We feel like we're getting busier than we've ever been. We don't know if it was the pandemic somehow that changed the environment, or is the environment just getting so toxic, more people are getting sick, stress levels are going up, food quality is going down. There needs to be some ray of hope here, because people are, they say the worst thing I can possibly imagine happening to me is someone telling me that I have cancer.
Yeah.
Well, your story is incredibly inspiring, Dan, and letting people know they can do the best of both worlds and have a much better success rate in the process.
Amen.
And this company isn't just a company out there to sell a product. They're a family. And every person that takes it becomes a member, because when I did walk in that door and I was so overjoyed, they not only said, hey, that's a great news, they shared in that joy. We all had tears. I mean, every single person in that whole office, including the people behind the counters, the gals behind the counters, doctors ate. We were Jason gave me the biggest bear hug I've ever had, cracked every bone in my body. So yes, when I was sitting there and got that phone call that I had 2 years, my life flashed before my eyes. And when I started to pray, Lord, give me an answer, and I use the analogy. I said Noah was facing certain destruction in the Bible, and God gave him the instructions to build an ark to save him. I needed an ark, and we started to pray as a family, and little did I know, I was already taking 8 pills out of what maybe I should have been taking 9 already prior to that point. God had already answered my prayers. And now looking back, I truly believe that this isn't just a company. I think it's a blessed company because of where this product comes from. The Holy Land between Bethlehem and Jerusalem. That's kind of, and the color is purple. If you are familiar with the Bible, that just screams blessed by the Lord. And then when I see the results, not just in me, but all my family, my dad had melanoma on his neck. He's 86 years old. They couldn't remove it because of the possibility he wouldn't live through the surgery. We put a Rumacil on it for 2 weeks and bandaged it. We were told that would help. And when we called the KU and said, we're not coming to have that removed for a high risk surgery, they said, why? Have you given up? We said, no, it's gone. They said, melanoma doesn't go away. And I said, well, it's gone. And so, and that's been 6 months ago. And it has not grown back. So we've just seen it over and over in my own family, in my friends and family and neighbors around. It's just, I just can't wait to tell people about it because it's just mind blowing what this stuff does.
There's a wonderful book called Anti-Cancer Living. And it's by a Dr. Cohen from MD Anderson, which is kind of like the cancer mecca here in the United States. And he describes 6 things that you need to be doing, lifestyle things you need to be doing to either avoid cancer or to get over cancer. The number one thing that he said the most research for was what he called connectivity. And that's what I think you're talking about. We need to be connected in our families, in our friends.
Absolutely.
And we need to care for one another and know that we can get well if we have that. Of course, the other 5 are important too, getting good sleep.
But that encouragement from the beginning is so important.
So important. So, well, gentlemen, thank you so very much for an inspiring talk. And I'm excited for Afaya. I'm hoping that we can do research. I'll tell the audience that we started research with Afaya right before the pandemic, and the pandemic flushed us out. So we're going to try to get going again here in the near future, we hope. And Dan, thank you again
thanks for the opportunity.
For being a living example of what this stuff can do to help people get over the worst of times in their lives.
Thanks for letting me tell my story.
You bet.
Thank you for listening to the Real Health Podcast. If you enjoyed this episode, be sure to subscribe and leave us a review. You can also find all of the episodes and show notes over at realhealthpodcast.org. Also, be sure to visit riordanclinic.org, where you will find hundreds of videos and articles to help you create your own version of real health.